Let's talk about the difference between Hodgkin and non-Hodgkin lymphoma. The first difference is the age. Hodgkin lymphoma usually occur in two peaks. The first peak is 20 to 35 years. The second peak is 50 to 70 years. Non-Hodgkin lymphoma typically occurs in patients around 65 to 70 years of age. Then comes the lymph node involvement. Hodgkin disease is milder, so usually it involves a single group of lymph nodes, and usually the spread from one group to another group is sequential. So there is sequential involvement or contiguous involvement of multiple lymph node groups. Usually, non-Hodgkin lymphoma loves to involve specific groups, such as it involves the epitrochlear lymph node. So we are talking about the non-Hodgkin. It involves the epitrochlear lymph nodes. It also involves the Wilder's ring in your oral cavity, the Wilder's ring, and also the mesenteric lymph nodes. Those are the lymph node areas that non-Hodgkin lymphoma typically involves. The Hodgkin's typically does not involve those areas. Then comes the extra lymphoid involvement, which is more common in patients with non-Hodgkin lymphoma. Involvement of the bone marrow is more common with non-Hodgkin lymphoma. Now, what's the difference between the symptomatology? The classic features such as B symptoms, weight loss, pruritus, drenching night sweats, and the pale abstent fever, all of those are more common in patients with Hodgkin lymphoma. They are less common in patients with non-Hodgkin lymphoma. What do you find in biopsy? So if you biopsy a patient with Hodgkin lymphoma, you may find the classic RS cell. The RS cell is the Reed-Sternberg cell. But in non-Hodgkin lymphoma, you will not find any RS cell. The prognosis? Obviously, the prognosis is worse with non-Hodgkin lymphoma. Why? Because it's often involving the non-lymphoid structure or extra lymph node structure, such as it involves the bone marrow, and it can involve other organs. So it has a poorer prognosis compared to the Hodgkin lymphoma. That's all. Those are the main difference between Hodgkin and non-Hodgkin. If we recap, Hodgkin, 2 peaks, 20, 35, 50, 70. Non-Hodgkin, 65 to 70 years. Lymph node involvement, Hodgkin, unicentric or single group. Non-Hodgkin, multiple group. Non-Hodgkin typically involves or may involve epitrochlear, Wilder's ring, and the mesenteric lymph node groups. In Hodgkin lymphoma, you will have a contiguous spread. In non-Hodgkin, the lymph node spread is not contiguous or not sequential. Involvement of bone marrow or extra lymphocyte, more common with non-Hodgkins. Then if you do the symptom analysis, the classic features, the B symptoms, pale abstent fever, itching, weight loss. So those are the things that are more common with Hodgkin lymphoma. The prognosis, worse with non-Hodgkin. Biopsy, if we biopsy the Hodgkin lymphoma, we will find the Reed-Sternberg giant cell, or those are the RS cell. That's all. Thanks for watching.